Welcome, everyone. It is my pleasure to open today's first session in the Translational Medicine PhD program, the first session today of the PhD Defense of the Gastroenterology students. I am supposed to give a talk. Could you please pull my slides? So this is the 8th progress report for these guys. And at the same time, this is going to be the defense of their PhD thesis. Let me just talk about very briefly about the Translational Medicine program, which was, the conception of this program was in Pécs in 2016, and ever since it has evolved from that. When it moved to Semmelweis University, it has significantly grown. It significantly grew. So the whole concept of Translational Medicine program is to bring science into healthcare and teach the medical people to understand and exercise clinical research. Our mission is to have a breakthrough change in science education and medical training. What is the evolution of the Translational Medicine program? Back in the old days, there were the bench side, and then there were the bedside practices and research, and they met halfway. And then when they discovered something, it took many, many years. If you look at research on this, the average time for conception of a new idea at the bench side lasted about 17 years until it got to clinical practice. And then there was this new translational medicine model in the early 2000s when, through 5 steps, basic science traveled to clinical practice. It significantly facilitated the travel of discovery from bench to the clinical practice, but was still very slow in producing good evidence from the bench side into the clinical practice. Now, I was lucky enough to be part of the third model, to developing the third model, which was done on behalf of the Academia Europaea, which is a society of scientists, more than 8,000 scientists, and 90 of those with Nobel Prize. And so this model tells about how you should ask a question at the bedside of the patient. How should that travel to science? And from science, how should we produce knowledge papers and then communicate those knowledge papers back to decision makers, policy makers, who are often scientifically not literate. There have been a lot of prestigious recognition of this model and the advancement of this model. 1 paper in Journal of Clinical Medicine, and then 3 following papers in Nature Medicine, which is, of course, one of the leading journals in medicine itself. So 2 models about how to accelerate the discovery and how to help to travel it back to clinical practice, and the other one, how to train pre-university students to become better scientists. The most recent one is a model how to interpret the results of studies and how to communicate these discoveries back to policymakers and decision makers who are not trained in clinical science and understanding clinical science. So through these models, patients heal better, and I'll give you a little introduction on when it was first properly done in Hungary and in the good old Austrian-Hungarian monarch. In 1846, Semmelweis was exactly a clinical scientist, what I've just introduced you. He posed a question at the bedside: how come patients in one clinic die much more likely, and how in the other clinic die less likely after a birth? And he discovered that in the better clinic, of course, the hand hygiene was much, much better. And he introduced those thoughts back after a retrospective study. He did a prospective study, and that proved his idea. So this is not a new model, and this is something which we have to go back to. And of course, this university is named after him. I'll give you two very brief examples of how we employed this model in the past. So why do we use a lot of antibiotics in non-infectious disease, which is pancreatitis? We did research, and we found that a large proportion of patients would have been given antibiotics. And once we did some research on this, and then we communicated it, we managed to reduce the antibiotic use in the hospitals who were part of this translational medicine program, and also we managed to reduce the length of stay in the hospital. A recent achievement by the same translational medicine model is from Bajcsy Hospital, which is a large district hospital within Budapest, and Tamás Horváth and Illés Kata, fantastic PhD student from this program, dealt with cholesteatoma. They looked into it, and they introduced new practice in their clinical practice, and they managed to reduce the recurrence of cholesteatoma, which is a very, very significant concern, by 13%. There is also academic benefits of this postgraduate translational medicine program. As you can see, we had 37 students within the translational medicine program back in Pécs, and then we moved to Semmelweis University, where we had access to more students and had a very good support from the leadership of the university. And by today, we have got more than 400 students in the translational PhD program of Semmelweis University. These are the publications by the team, and you can see JAMA Pediatrics, Nature Medicine, JAMA Oncology, Critical Care, and I wouldn't like to read all the titles of these journals, but they are really at the forefront of clinical research. Of course, this wouldn't work with a lot of staff. There are more than 800 people involved in translational medicine, people who help these students in many respects. There are lots of projects, many hundreds of projects, 205 already accepted, 416 articles, and a cumulative impact factor from this program of more than 2,000, with an average impact factor of nearly 5. So we want to reform the doctoral training, and due to lack of time, I will just let you read the main points. Basically, we want to improve the number of PhD. We want to improve the quality and the number of students coming out from this program. We've got fantastic lectures for these students in the program, some of them by Nobel laureates and some of them by very highly distinguished clinical researchers. Can you start, please, the video?
Science is an indispensable element of progress and the future. Science changes lives when discovery leads to action. The National Academy of Scientist Education makes this happen through 2 programs. The Discovery Science Program, which focuses on nurturing future researchers, and the Translational Science Program, which turns knowledge into real-world applications.
I think the development is fantastic. When I came first time, it was a program centered in Szeged, with students coming from different parts of Hungary. But meanwhile, the program has developed into 2 branches, and actually one of these branches aims at revolutionizing science education in all of Hungary.
I don't think you can be a good physician today without understanding science, without doing science at some time in your life, asking questions, critical questions, analyzing the literature.
The Translational Medicine Hybrid PhD program, launched in 2016, aims to provide healthcare professionals with the knowledge essential to translate scientific results to their patients' benefits. Since 2019, 50 students, including doctors, dietitians, psychologists, and economists, have defended their PhD theses as part of the program. To date, more than 350 PhD students and 200 mentors from 24 countries have joined the international program. Recently, the program has accelerated significantly with the support of Semmelweis University, the government of Hungary, and Academia Europaea. Healthcare professionals have been able to demonstrably improve the quality of patient care in a short time, which, in addition to its positive social impact, has also resulted in cost-effective patient care.
If they choose to develop a career in science, they will have the view of the entire distance between the patient bed and the route to try and cure and help and develop drugs like we do.
Besides the several professional and social events, students of secondary schools and universities, as well as healthcare professionals, can attend the meetings of Nobel laureates and talented students, which are organized by the Academy twice a year. At the conferences, approximately 2,000 guests, pupils, students, mentors, doctors, and other faculty members can listen to scientific presentations of professional quality, participate in educational events, and meet or talk to Nobel Prize-winning scientists and internationally renowned researchers. Since the first meeting in 2012, the Academy has held 24 successful conferences, with the prestigious participation of 18 Nobel laureates hailing from different parts of the world.
First of all, I have a tremendous admiration and inspiration by what is done here to this program. This program is unique around the world. It's very special. It's not only going to improve Hungary, it's going to improve not only Central Europe, it's going to be a motor for progress, innovation, and a better world around the world.
The capital that you are building through this program, human capital, social capital, and potential economic capital, this is a great investment, and I really think that every country should have programs like this, and I think that you should invest as much as you can afford it.
Peter Higi convinced me that it's a good idea to train young people of the area of Szeged, and knowing Peter Higi, I know that he's a very hard worker, very enthusiastic, and I just got infected by his enthusiasm. All I can say is I'm very impressed, and I hope it continues like this.
So thank you very much for watching this video.